I'd like to welcome back to the stage Myles Chadwick, who's going to be talking about making veterinary care affordable and accessible, why and how.
Hi everybody, how's it going? It's the afternoon, so I'll stay awake a little longer. All right, so I am going to talk a little bit about my organization in more depth than I did yesterday. I'm going to talk about the services that we offer, why we offer them, a lot of the philosophy that goes into how we offer them, the actual methodology, the way that we train our staff, the way that we engage with our clients, and hopefully give you guys some stuff that you can take and use in your own organizations. So, as I said before, I work for Emancipet. I don't know how to change the slides. Our mission is to make veterinary care affordable and accessible to everyone. One of the things I love about our mission, it's changed over the years. Even in the 5 years that I've been at Emancipet, our mission has shifted slightly. One of the things that I think is really important about it is that we have both spay-neuter and veterinary care in our mission on equal footing. And what that means is that when we have somebody come to us for a desexing for spay-neuter, that is a victory. But when we have somebody come to us for a rabies vaccine, that is an equal victory. When we have somebody come to us for their dog's first set of boosters for distemper parvo, that is a victory. So we don't put the surgery above everything else, which I think is one of the norms that I've seen in a lot of the organizations that I've worked with in the past throughout the U.S., is that anything other than a spay-neuter surgery is a failure. And we see all of these services as being really valuable to improving the health of the animals in our community, and so we always want to celebrate each one of those things. So like I said, our mission has changed over the years, and we've changed as an organization quite a bit. We started in 1999 as a mobile clinic. And a wealthy person in Austin, Texas, bought a mobile clinic for a couple $100,000 and leased it to our organization for a penny a year. And the idea was, this was coming out of the 90s, which is when sort of high-volume spay-neuter clinics were really popping up all over the place in the United States. Spay-neuter was seen as the future of how we were going to end shelter overpopulation and animal homelessness. And so the idea was a few technicians and a couple of veterinarians were going to go into the poorest areas of town with this mobile spay-neuter unit and do as many surgeries as they could. And in 2 or 3 years, we were going to have this problem licked. There weren't going to be any more homeless animals. All the animals were going to be spayed and neutered. It was a super realistic goal. We didn't have any infrastructure built. I've heard a lot of horror stories about the old clinic. Our base of operations didn't have running water. It was running on generator power, which would go out frequently, and I've heard that there were rats and snakes. I don't know. I don't want to know more information than that. That's already too much information about that. But we've changed a lot. I think after the first few years, we realized that we were going to have a longer battle ahead of us than we had set out for. And so over the years, we started doing more and more surgeries. Initially, all we offered was surgery and maybe a rabies vaccine because it was required by law. Over time, we started to add in a couple more things, maybe an FVRCP vaccine or a DHPP vaccine. Then we started offering flea and tick medication. We would only see animals that were coming to us for spay and neuter, and we wouldn't see them again after they had come to us. But over time, we started to become more flexible. In the mid-2000s, we decided, okay, if you've been to us for surgery, you can come back for a booster for your vaccine next year. And then we were like, okay, if your animal's already fixed, even if we didn't do it, you can come and we'll go through all the effort of making a new client chart so that you can get a vaccine from us. I think there was laziness in some of this more than philosophy. But in 2011, we made a pretty big decision, which was we were going to break our wellness services that we were offering at this point. We were having people come every day. Maybe it was a dozen people, maybe it was 20 people. The numbers had started to grow. And at this point, we had a building location and a mobile. We started having people come, and it was starting to be a burden to the team that was trying to do surgery, right? Like the vet would have to put eyes on an animal while they were trying to do 35 surgeries that day, and okay the technician to go ahead and give them a vaccine. we realized, we probably could sustain a full-time healthy pet services clinic, preventive vet care clinic. And so we decided in 2012, 2011 to break that service out, have its own dedicated staff for it, be open and advertise to the public for it. And there was one really big thing that we decided to change, which was pretty controversial at the time, which was that we were no longer going to require that animals were spayed and neutered in order to come see us for those services. And I don't know how you guys feel about that. I can tell you that in 2011, some of our staff that had worked with us since 1999 that had tattoos of our logo on them were pretty upset. They felt like we were betraying our mission, which at the time was to make spay-neuter affordable and accessible. One of the funniest stories about that happening was one of our technicians stood up at a staff meeting when our CEO announced it and said, "Are you telling me that every day we're going to have intact dogs and cats filling our waiting room? It's going to be mayhem. It's going to be bedlam. There are going to be dog fights. There's going to be cats getting loose." And our CEO said, "We're a spay-neuter clinic. We have 35 intact animals in our waiting room at the same time every single morning, every day of the week." To which she quietly sat down and listened to the rest of the speech. So we've been powering forward ever since. In 2011, when we made that change, we were doing about 20,000 surgeries a year, and we were seeing less than 10,000 animals a year for vaccines. In 2012, we saw about the same number of animals for healthy pet services as we did for surgery, so right around like 20 and 20. Last year, we did around 30,000 surgeries, and we saw over 70,000 animals for healthy pet services. So those numbers have grown exponentially. We're seeing many, many more animals for healthy pet services than we were seeing than we do for surgery. And depending on the community that we're in Austin, where we've been the longest, most of the animals that are coming in for our healthy pet services are already spayed and neutered because we've been there so long and we have so many resources for that. But in new communities that we go to, we're seeing animals coming in every day that don't really know what spay-neuter is, haven't really had a conversation with the veterinarian about it before, but they do know that they need a rabies vaccine, or they do know that they're sick of their dog having fleas, and so they come in and we're able to have those first conversations. So, what we believe. I talked about this yesterday. I've gotten a lot of feedback about it from y'all. We believe that people love their pets, and we believe that they'll do the best that they can for them. We believe that when we're out in the community and we see an animal that is underweight and that maybe is running free in the street, or maybe that is on a heavy chain, when we see an animal that has matted fur, we believe that that animal is loved, and that the people that are taking care of that animal are taking care of that animal to the standard of their community. So what does that mean? It means that the aberrant behavior of one or two individuals is not the rule. When you have an entire community of people that are all taking care of their animal in a similar way, and that similar way doesn't look exactly the way we want it to, it gets harder to say they're all bad people. What they are is all taking care of their animals to the standard of their neighbors, of their friends and their family and their parents, likely. So we believe that what we see may not look the way that how we take care of our pets, or how we would want everyone to take care of their pets, but that it doesn't mean that they don't love those animals. It just means that they haven't had exposure to all the same resources and ideas that we have. We believe that people want to do good for animals and will take action if given the opportunity, and that it's our responsibility to build the infrastructure for that change to happen. So we have to build our clinics in order to give people the opportunity to have first experiences with a veterinarian. So what we do at Emancipet, as I just said, direct services. We own and operate clinics throughout Texas, and we opened in Pennsylvania recently. We are looking at some other states. We are looking at more aggressive growth over the next few years. We advocate for strategies in public policy that improve the lives of animals, of companion animals. So mostly our CEO, sometimes myself, work with city councils around the United States to form budgets and policy that we believe will improve the lives of animals in their communities. The city of Austin has had an above 90% live release rate since 2011. And so we are often sought after for our opinions on how we made that happen, how we were a part of making that happen along with our other partners in the city. And then we also train other organizations and individuals on social change strategies. So when I talk about social change, I'm going to talk a lot about it tomorrow in my presentation, so I'm going to talk only a bit about it right now, but just so you guys understand what I mean a movement where the behavior of a large portion of people is changed. So spay-neuter as a social change movement in the United States is actually a great example of a very successful social change movement. Currently in the United States, 91% of owned cats are spayed or neutered. 87% of owned dogs are spayed or neutered. So most of the animals that are living in homes in the United States are spayed or neutered. That being said, we still have estimated, depending on who you talk to, between 2 and 3 million animals a year being euthanized in shelters. So why is that? Prior to the 1970s, about 10% of the animals in homes were spayed or neutered. In the mid-1970s, a couple of veterinarians wrote some of the first papers talking about the benefits of spay-neuter. Veterinarians started to recommend spay-neuter to their clients. Bob Barker started recommending spay-neuter to everyone at the end of The Price is Right, and there were only 3 channels in the United States at that time, so people were forced to watch that show. New technology and new science is often a driver of social change. Look at the iPhone, for an example. So that new technology, or that new science around the benefits of spay-neuter, and then the new technology of being able to make smaller incisions and do faster surgeries led to the proliferation of high-volume spay-neuter clinics throughout the United States. And so that now, over 40 years later, as I said, 90% of the animals are spayed or neutered. So we went from 10% to 90% in 40 years. That's a massive success. But there's a caveat to that, of course. When you look at households with an income of $35,000 a year or more, those numbers hold true. So in the United States, if you make $35,000 or more a year, chances are your pet is going to be spayed or neutered. But when you look at households under that income level, it drops to about 60%. And the lower you go in income, the lower the number of spayed or neutered animals becomes. And so when you hit the American federal poverty line, which is very low, it's around $16,000 a year for an individual, it's only about 10%, which is crazy, right? Because that's the same number that it was for everyone prior to the 1970s. So we've left this cross-section of the public behind. We've left an entire portion of our country behind simply because they don't have the means and because there are not resources within their community. There are a lot of reasons, but one of the number one things that you'll see when you say map where most of the stray animals are coming in, owner relinquishments are coming in from in a city, and when you map income on a city, and then you map pet stores and veterinarians in that city, what you'll see is that the lowest income is generally where the most strays are coming from, the most owner relinquishments are coming from, and you will also see that there are little to no veterinary clinics in those communities, that there are no big box pet stores in those communities. Typically, at least in Texas, people are buying their pet food from feed stores. So there's more of a old school Texan cowboy vibe going on there. But yeah, the more you look at the data, the more you see that there aren't even clinics in these neighborhoods. When we started building all these clinics all across the country, we weren't particularly strategic about it. People built the clinics where they could. People didn't think so much about building the clinics inside the neighborhood that needed them the most. If you look at that data and you think, then we need to open lots of spay-neuter clinics inside those neighborhoods, then we would be in agreement. And that's very much what we've been trying to do. But we've also realized that that's not really enough. Opening a spay-neuter clinic inside a neighborhood that's never had access to a veterinarian is probably not going to be a super successful venture because people don't really know what spay-neuter is, nor are they really incentivized to do it. So we started looking at at offering more services and opening these clinics inside these neighborhoods because we know that some of those services are more likely to translate across barriers. There's another really interesting study that came out at the end of 2015 from the ASPCA. They asked pet owners who made a salary of $50,000 a year or less, who had relinquished their pets to the shelter, what resources that if they'd had access to them, they might have been able to keep their pet. Sounds kind of confusing. Does that make sense? So the thing that jumps out to me about this is that 30% of people said that if they had access to free or low-cost spay-neuter, they would have been able to keep their pet. 40% of people said that if they'd had access to free or low-cost vet care, they would have been able to keep their pet. And that income bracket is much, much higher than any means testing that any organization I've ever met in the United States is using. $50,000 a year is not thought of as low income in any community in the United States. But the reality is that it's not really that much money when you're faced with the cost of veterinary medicine in today's market, and especially at least in the United States. So we're very intentional about how we build these clinics, and part of the reason I'm giving you all this data up front is that I want you to understand the thinking that goes into where we build them. We build them inside areas where the median income is around $35,000 a year, because we know that that's the jumping off point where people start to not seek out spay-neuter. We know that if we build them in areas where, say, everyone's living at around $20,000 a year, we likely will not be able to sell any low-cost services because people won't have any discretionary income that they can spend on that. We like to locate them in the $35,000 range because there are people that are going to be living in that area that can afford low cost, and we like to locate them in areas that are close to much lower income areas so that we can reach people who can only afford free. When I talked about creating social change earlier, this model is sort of at the core of how we think about creating that change. So when we open a new clinic in any area, the first thing that we do is offer services that fall into this outer ring, which is the bottom box. Programs for people seeking low-cost spay-neuter and veterinary care. What that means is these are people who know what spay-neuter is, they know what the vaccines are, they know what they want and what they need. They likely came from a family that spayed and neutered their pets. They likely live in a neighborhood where their neighbors spay and neuter their pets. They likely are familiar with basic veterinary knowledge. And they have a value around it. They want to do it. They're seeking it out. Does that make sense? So we want to have that, right? You always have to have a resource for people that just need something that's affordable. But we're not changing the world by doing that. These are people who already want to do it, and if we don't exist, they're going to find the next cheapest option. They're just looking for the deal that they can afford. So the next ring in is programs for people who are seeking free services. So these people are a lot like the people in the outer ring. They know what the services are. They already have a value around them. They want to do them, but for whatever reason, which is none of my business, they need it to be for free. So the next thing we always add is programs for people who are seeking free. And it's really important to have this step before we get to the center ring, which I'll explain in a moment. Again, there might be a little bit of social change happening at this middle ring, but not a ton, because we're not talking about changing hearts and minds. We're talking about providing a service that people are already looking for. Maybe they wouldn't follow through with getting their rabies vaccine. Maybe they wouldn't follow through with getting their pet microchipped if there wasn't a free option. So that's the argument for, like, there's some social change happening there, but in general, we're not changing a lot of behavior. The center ring is really the sort of, I call it the holy grail of what we do. And it's programs for people who are not seeking us. They are not looking for spay-neuter, or they are not looking for vaccines, or they are not looking for flea and tick medication, whatever it is. Our goal is to move people from that center ring into one of the other two rings. And we have a lot of programs that are designed to do that. But by offering low-cost, healthy pet services, and I keep using that term because that's the term we've landed on after several years of trying out different names, healthy pet care, healthy pet services seems to resonate with the clientele that we serve the most. It doesn't seem to need description. They understand what it means. We used to use preventive vet care, and it was a little too jargony for most of the clients that we were serving. So people that are in that center ring are oftentimes most likely not going to be familiar with spay-neuter, or if they are familiar with it, the information that they have may not be accurate. They're not going to come looking for us. They're not going to Google spay-neuter clinic near me. It's just not on their radar. These are people that are oftentimes living check to check, oftentimes living in crisis. Oftentimes things can change dramatically from day to day and week to week as far as their resources and what they have to deal with. They, however, are a lot less unlikely. They're a lot more likely, double negatives. They're a lot more likely to have heard of maybe things like an ID tag or a rabies vaccine, because that's something that the animal control will actually check in with people about. So by offering these healthy pet services, we are opening a doorway to having conversations about all of these other things with people that are in the non-seeking category. So how we do, and I'm going to get into the logistics. Oh, there's some weird formatting thing happening there. I'll explain it to you. I'll get into the logistics of like what we offer in a moment. So just a little bit more changing the world stuff. We feel that the experience at our clinics is as important as the services that we offer. In fact, I would say if I had to choose between being able to offer all of the things that we offer, but having crappy customer service, and having amazing customer service and only being able to offer an FVRCP vaccine, I would choose that. Because ultimately, when we have people coming into our clinics, this is probably the first time that they've ever been to a vet, maybe the second time. If it's in one of our communities, we might be their vet. And every time that we have an opportunity to interact with them, we have an opportunity to transform their beliefs and their values around providing veterinary care. We have the opportunity to open their minds and their hearts and share information and make them really receptive to receiving that information because they see us as a trusted resource and because we're not judging them. So we have our core values that we look at everything through: compassionate service, teaching and learning, excellence, and optimism. I could go off about those, but I'm not going to. Our bottom lines, I think, are really what's key here. And I know this is something that addresses questions that I got a lot yesterday after my speech. Sustainable finance, transformative service, and quality medicine. So quality medicine means that we do not cut corners. We do not have things that we don't need because it's not financially sustainable to have things that we don't need, but we also don't do anything unless we have the right tools and the right processes and procedures and training in place to do it. It's very important to us that all of our clients coming to us feel as comfortable coming to us as I would feel going to a private practice vet. And in fact, we would never want to do anything at our clinics that we wouldn't feel comfortable doing for our own pets. So we always look at it through that lens. That being said, everything, because we are a nonprofit, everything must be financially sustainable. We can't throw money away. We can't have stuff that we don't need. And these three things kind of live in constant tension, because the transformative service is just as important, as I already mentioned. If we're financially sustainable and the quality of the medicine is really high, that's great. But if people that come to our clinic feel like they're being treated poorly, then none of it really matters anymore, because we're not going to be driving new people into the clinic and we're not going to be changing hearts and minds. My nose isn't running anymore, but now my voice is going, so new challenges every day. So what do we stand to gain by offering these low-cost services? Reaching the remaining 10% is one of the most obvious things to me, at least in the US. If we have 10% of the population, or 10% of pet owners of owned pets who are not spayed and neutered, and those are driving most of the shelter intake at this point, then we need to build systems for addressing those animals and those pet owners. Increasing community pet health literacy. People just don't know what they don't know. People that have never been to a vet before do not know much about animals. Before I worked in animal welfare, I didn't know that much, and I'd had animals my whole life. I don't think I'd ever really had an in-depth conversation about parvovirus or heartworm. I lived in an area where those things weren't prevalent, so I didn't really have to worry about it. But when we're talking about communities in Houston is a great example, especially with everything that they're going through right now. There are huge cross-sections of that city that are just working poor, systemically poor, generationally poor, and they have never had access to this knowledge. So we need to make sure that we're providing access to this knowledge and that we're doing it in a way that is going to make them really receptive to it. We're creating new service seekers. One of the questions that I got yesterday, and that comes up a lot when I do this talk in the United States, is what about private practice veterinarians? What about the not-for-profit vets? Do they give us trouble? The answer is yes, they do on the front end. When they know that we're coming to town, sometimes we have vets push back and say, you're gonna steal all our clients, you shouldn't be offering these services. Honestly, most not-for-profits in the United States live in fear of veterinarians in the private practice and make decisions based on that fear. I'm not afraid of them. I was when I first started out because everybody told me they were gonna take me down. The reality is they can do what they can do, and we're going to still fulfill our mission. What I see happening, and one of the sort of biggest danger things that I've seen happen, is people are so worried that they're going to get in trouble with their local vet community for offering, let's say, emergency service to a hit-by-car dog, that they do it. It's like, say it's a high-volume spay-neuter clinic. That's all they're supposed to be doing. They'll end up doing random amputations, mass removals, enucleations, dealing with a hit-by-car dog, scripting out antibiotics to sick animals, and they'll do it on the down low. They'll do it in a way that, hopefully the local vets won't find out about it. That's real dumb. That is a way to actually get yourself in trouble. So all I'd say is, if you want to offer full service medicine as a nonprofit, frickin' do it. Put it in your mission, change your operating guidelines, be transparent about it. As long as you're up and honest and open about what you're doing, there's no reason that the veterinary community should be able to take you down. If you're designing your programs well and you're serving the clients that need you, not by income qualifying, but by actually building clinics for them in their communities, you're not going to hurt those vets' businesses. And in fact, you're going to create new veterinary seekers. You're going to increase the herd health of all of the animals in the community, and you're ultimately going to create a happier, healthier city. And ultimately, the goal of all this is keeping healthier pets in homes. And, animals get relinquished all the time because they're sick, because the pet owners, can't afford to keep them because they got pregnant and now they've got kittens and their housing development won't let them have them. There's so many reasons that just having access to low-cost care ends up keeping animals out of shelters and ultimately saving cities money. So these are our prices. I can't tell if you guys can see that. It looks a little bit blurry. Everything at Emancipet is a la carte. So we don't do pricing bundles. I don't know if that's a thing here. In the States, some of the other organizations that are starting to do this work do bundles because they want to make sure that every animal gets everything. What we found is most of our clients can't afford a bundle. We price everything so low that if they can afford the bundle, they can afford them a la carte as well. We also think that there's value to actually going through the selection process of each thing because, again, this is an opportunity to inform. This is an opportunity for them to actually understand what the different vaccines do, what they're choosing between. Our technicians are empowered to kind of figure out the hierarchy of need. If people have $20, they'll help them figure out how to spend that $20. We charge $5 to see the veterinarian. That is the first thing that we waive if money is a concern. Any one of our vet techs can just say, don't worry about the $5. All of our spay-neuter surgeries are $69, male, female, cat, dog, any weight, doesn't matter. That's relatively new. That pricing is designed to be really simple and really transparent so that people don't feel like there was a bait and switch. We never felt like it was a bait and switch because we know what it is. We understand that sometimes an animal's in heat and the surgery goes long and you have to give them fluids and it costs us more money, but that doesn't really make a difference to the pet owner who's never gone through this process before. So we just decided to build pricing that can kind of accommodate all the things that might come up and charge one cost for everything to everybody. We've kind of moved that direction with everything. All of our vaccines are $15. We used to have them at different prices based on what we were paying. We lose some money on some of them. We make some money on some of the other ones. We just made them all the same price because it's a lot easier, and that way people aren't picking the cheapest vaccine because that's what they can afford. All of these services on this brochure are preventive, but we also offer some stuff outside of that. And one of the things that I like to talk about is what we could be doing. What are we going to be offering in 5 years? So everything in Tier 1 is what we offer right now, and what I feel like any high-volume spay-neuter clinic, possibly shelter, can offer pretty easily without having to do a major renovation, without having to buy a bunch of new equipment. Core vaccines, ID, which includes microchipping, tags, and collars. We have a rule at our clinic that no one leaves naked. So if a pet comes in and it doesn't have a collar, we give them a collar. If a pet comes in and gets a rabies vaccination, we engrave the owner's information on the back of the rabies tag. We've modified all of our engraving machines to fit our rabies tags. And generally, all this stuff is going to be preventative and is going to be pretty easy to offer. Once you get into tier 2, you start to talk about where you might need, a little bit more space. We offer low-cost heartworm treatment and low-cost dentals at our clinic right now. We're looking into offering euthanasia maybe down the road. We're looking into offering outpatient parvo treatment down the road. We're just in the process of building a new facility that has kind of some play space where we can start to experiment with new treatments that we can then roll out to all of our clinics. I'm starting to run low on time, so I'm going to move forward quickly. You guys can ask me questions at the end. We run a shared services model. So what that means is we have branches and we have direct animal services at each one of those branches, and then we try to put everything that doesn't need to be on the ground in the clinic into a centralized branch. So that centralized branch answers the phone and books appointments for all of our clinics. They answer between 600 and 1,000 calls a day. We do all of our HR there. Some of our fundraising is centralized. Our payroll is done there. Basically, it's nice because our clinics do not have to answer the phone at all. If they are answering the phone, it's shared services calling them about something. Oh, another weird. Some of these slides got kind of messed up in the translation. I have a Mac, so I think it got weird. We have a 80-20% financial model. 80% of our fees, or 80% of our revenue comes in from fees for service, and 20% is fundraised. If any of you guys are in my workshop on Saturday, I'll talk more about that. If you have questions about that, you can ask at the end of this. One of the big things about making that model successful is that everyone at Emancipet goes through a training in their first month called Culture of Philanthropy, where we explain why it's awesome to fundraise for our organization by asking every client if they'd like to make a donation. Our biggest donors are actually our free day clients. On average, our free day clients donate $1 per client. Across the entire organization, $3 per client. Across the entire organization, our clients donate about 90 cents per client, which means that if we saw 100,000 animals last year, that's $90,000 that came in just from client donations at the point of sale. So we're really big into we never guilt trip people about money. We don't try to extract money from people, but we do offer people the opportunity to give. And when we're talking about people that have never had access before, when we're talking about systemically poor communities, they actually are kind of excited to be asked, to be offered the opportunity to pay it forward because they appreciate the service that they're getting. And if they have the extra dollar to give us, they love to do it. I'm going to do an entire presentation tomorrow on customer service for social change. So I won't say much about this aside from it's important, and we'll talk about it tomorrow. And I want to tell you one short story, and then I'm going to show you a video. So this is Tasha. Tasha came into our outreach program in 2011. In this picture, you can see that she's tethered to a doghouse with hay in the background. So this picture was taken when she'd been in the program for a couple months. We gave her that doghouse. It's fully insulated. She lives in a climate that gets down below 0. She lives outdoors most of the time. When we first met Tasha, she was really, really underweight. She had parasites. She was on a heavy chain, and she was living in substandard housing that was not okay for the temperature where she was. That house is fully insulated. It was built by the Carpenters Union in the city where she lives and donated to us. They build a dozen of them every year for our clients. We deliver hay to her all winter long, and it basically never gets cold inside that house. She can live out there full time if she needs to. Her owner's name is David. David had lived with Tasha like this, just like he'd lived with every dog he'd had before Tasha. This was the way he was raised. This is the way that his uncle, who he lives with, also has a dog that was living the same way. And he didn't really see anything wrong with it. The dogs lived outside. The dogs had parasites. They loved the dogs, but that's just how dogs live in that community. David recently reached out to Matt, our outreach strategy manager, and said, I just thought of something really crazy about Tasha. She's the first dog I've ever had to get gray. So that's Tasha now. She's no longer chained up. We didn't tell him you have to get your dog off a chain today because that wasn't realistic for him. He had nowhere else to put her. He didn't have a fenced yard. And so we got her onto the lightweight tethering device initially. And then over time, we were able to go in and build a fence for him and for the other dog, get them both spayed. And now they're all living super happy and healthy and into old age. And he brings her into the clinic himself and gets all of her annual stuff done. That's a really, really happy story. I'm going to show you guys a quick video, and then I'll be done. That is full of really, really great stories. For those of you who asked me how to fundraise without a bad guy, watch this video.
Who do you have dropping off here? Benjamin. Benjamin, here for surgery? Yes. All right. Hi, Benjamin.
I've had a dog ever since I can remember as a young kid. I really can't remember too many times without a dog, except for when I was overseas, in the military. So I don't know if there's something wrong, I just want to be checked.
All right, heart sounds good.
So I've always had a dog. I don't know if I could do without a dog.
Any other questions?
No, ma'am. Companionship, loyalty, playmate. They're part of the family and you can't do without them.
We got Coca-Cola when one of my wife's coworkers found 2 kittens in a parking lot. We got her in like a little box and we took a video of her in the backseat of the car, meowing and jumping all over the place. And we were just like new parents. This little bitty creature was like depending on you, and that particular bond has kind of carried on to this point. The house feels different. She's there to greet you. It's like the house has a soul.
This is Cheeky. She's the boss of the house. She'll bark a lot, but she won't ever bite anybody. And this is Diego. This is the old king of the house. He's 10 years old. Diego, he's been with us since my daughter was born, and he used to stay right in front of her door and just like watch her. They help a lot with pet therapy for me. I'm diabetic, and when I feel depressed or non-energetic, my animals are a big help to me in my life, and they give me a lot of joy. All my animals do.
Judge, he's extremely loyal, very laid back, loves cuddling. He's a big teddy bear. I use him as my service dog because I have extreme PTSD. When he senses that I'm getting anxious, he jumps on me, starts licking my face to calm me down. I don't know how he knows it, but he just does. When my anxiety attacks hit me, he just lays on top of me. Yeah, I'm okay. You want to get up here? I don't have kids, so I treat him as my son. Your breast stinks, you know that? So what kids don't give me, he does it for me. He's my boy.
A friend of mine, another homeless guy, he kept telling me about Poopsie living in this camp with a bunch of kids that didn't know how to treat her. She'd been passed around by 4 different owners by the time she was 1 year old. And she was real needy, insecure. I felt she needed somebody to take care of her. At that time in my life, I was 24/7 drunk. I just one day laid up and went cold turkey because if I couldn't take care of myself, I couldn't take care of her. So we kind of rescued each other. Bring me the toy. Give me the toy. Bring me the toy. It's been like 11 years now. 24 hours a day. We're together all the time. Emotional support, comfort, that never been able to get from a human being. That's how it goes sometimes. But she's there. Reach out and touch her, she's there, just there.
I like Emancipet. They help a lot in the community. They're great veterinarians for us, and they love animals, and they like helping people with their pets.
I recommend this to everybody that I know that has animals. They're really good with the animals,
Okay. You were being so good. There you go.
and they're friendly.
It's good to see you.
I'm retired, so it's a lot easier paying here than it is going to a vet that's extremely high.
Thank you.
No problem.
This is where my dogs come. If I had cats, they'd come here, but I don't have no cats.
All right. Are you ready?
She had a skin issue, and I used to feed her any old thing, and she was chewing her fur off and had real issues. Like, I didn't know what it was until I took her to Emancipet, and she was diagnosed. Well, look at that. Poopsie Brown. What's the sense of a vet you're going to do that? Silly dog. Without Emancipet, wouldn't have been possible because you need special medications. I wouldn't be able to afford all this, you know. So it wouldn't have been possible without y'all. You know, my estimation, not only to save one life, to save 2 lives.
Thank you.